Today we'll look at trachoma. Trachoma is a chronic keratoconjuctivitis caused by chlamydia trachomatis, which affects the conjunctiva of the eye and the cornea of the eye. So the predisposing factors to trachoma include: number 1, neonatal ophthalmia, poor facial hygiene, living in dirty and dusty environments, flies, overcrowding, lack of water, and sharing face cloth. Then the agents that bring about trachoma include fingers, fomites, flies, fecal, and families. Families being the last, mostly in children. Mothers are the ones who are more in contact with children, so they're likely to transmit this trachoma to the children if they have. So signs and symptoms. In the beginning, there's usually just red eyes and discharge. And after a few weeks, there's an active trachoma. And an active trachoma will present with follicles on the tarsal aspect or the conjunctiva of the eye. And there will also be scarring on the conjunctiva, the same. So the World Health Organization has a way of grading trachoma. And this includes the active trachoma follicles, or TF. So you can call them trachoma follicles. There must be at least 5 follicles on the tarsal plate. So when you examine the patient, you find that there are some follicles, round follicles, which are whitish in appearance on the patient's conjunctiva. This should help you say that this is trachoma. They're usually white and yellowish. Then there's also active trachoma intense, or TI. The follicles here are many. Remember, in the first one, there were just 5 follicles, but in trachoma intense, there are many follicles and papilla on the tarsal plate, meaning that when you open the eye on the conjunctiva, the papillae are going to be looking like projections, long projections on the patient's conjunctiva, and this usually indicates that the infection is very severe. So the other grading is trachomatous scarring, or TS. So the scars are white and they present on the upper tarsal plate. This usually shows that the patient has suffered from trachoma before. So when you see that the conjunctiva of the patient's eye is actually scarred, you know that the patient suffered from trachoma some time back and they've come back with it. The next one is what we call trachomatous trachiasis. There are some eyelashes rubbing on the cornea. So the cornea of the eye will be rubbed by eyelashes, meaning the eyelashes will be protruding inside the cornea, and usually the patient will be scratching a lot and they won't be seeing. This mean the infection is bad, and usually there's some cornea opacity there. So the other one again is cornea opacity, which is the last one, or CO. Their cornea opacity is present, blurring some of the pupil margin or lowering the vision. So when you see some opacities on the cornea, which will look like crystalline-like or whitish around the cornea, and this will lower the vision of the patient. So how you can make a diagnosis of trachoma? The first one is when you do a physical examination, you see the symptoms like trachoma follicles, or you see trachoma active, intense, or trachomatous scarring, or even trachomatous trachiasis, like I explained earlier. These are the things that you see when you do a physical examination. When you take history, the patient will show you the previous predisposing factors, like living in dirty environments, overcrowded places. They will tell you about staying in places where there is no water, and some of them can even review that they had a trachomatous infection previously. And then you also do microscopy, culture, and sensitivity in order to know the causative microorganism, which will help you give the exact antibiotic to give.